The $15,000 facelift is more expensive than the $35,000 one. That sounds like a marketing line. It isn't. It's just math, and I'm going to spend the next few minutes showing you exactly why. Hi, my name is Dr. Raghu Athré. I'm a double board certified facial plastic surgeon in Houston, Texas. I've been performing facelifts for almost 20 years, over 1,000 of them. What I'm about to tell you is what most surgeons in my position won't say out loud because it's just a bit uncomfortable for our industry. But on the other hand, you're trying to make one of the biggest decisions of your life. You deserve the actual math. A facelift isn't one product. Here's the first thing you need to know. A facelift isn't a single procedure. It's a bundle of 4 to 6 separate services. And in our hands, here at my practice, maybe even more. And each one has its own price. There's the surgeon's fee. Then there's the anesthesia fee. Then there's the facility fee for the operating room personnel, and all the medications used in the operating room. Sometimes there are post-op garments and some supplies that are hard to get for the average patient. Then there's follow-up visits. When you see a $15,000 facelift advertised online, you're looking at one number, the surgeon's fee. The rest arrives at billing time. By the time you get to the operating room, that $15,000 facelift can become a $22,000 facelift. And you just don't realize it until you sign the papers. It's not because surgeons are trying to deceive you. It's because the industry has just gotten very, very comfortable quoting only the visible number. When I give you a quote, I quote you the all-in number: surgeon, anesthesia, facility fee, garments, all the follow-up visits. No surprises at billing. Whatever surgeon you choose, ask them this one question. Is this the all-in price or just your fee? Their answer tells you everything. Truth number 2. Depth drives the cost. The single biggest cost driver in any facelift is operating room time. Let's say, for example, you're doing a skin-only facelift. That takes roughly maybe an hour to an hour and a half. A SMAS lift, maybe 3 hours. A deep plane facelift, we're looking at 5 to 6 hours minimum. A deep plane facelift done correctly in anyone's hands can take at least 5 to 6 hours. You just can't compress those hours. There's no shortcut. The anatomy doesn't get faster. Maybe you get a little quicker the more you do them, but it doesn't change that much. Every minute in the operating room has a cost. The anesthesiologist, the anesthesia, the medicines, the facility fee, and the surgical staff. The longer the surgery, the higher the cost. So when a surgeon advertises a facelift at half the price, what they're really offering you is half the procedure. Different anatomy, different depth of dissection, different result, different longevity. It's not the same surgery just sold cheaper, it's a different surgery. Truth 3. Longevity changes the math. This is the one most patients haven't thought about. A $15,000 SMAS lift typically lasts 5 to 7 years. A $35,000 deep plane facelift typically lasts 12 to 15 years. So let's do the math behind that one. $15,000 divided by 6 years equals roughly about $2,500 a year. $35,000 divided by 14 years is also about $2,500 a year. So therefore, the cost of the $15,000 facelift and the $35,000 facelift are both about $2,500 a year. It's the same annualized cost. But here's the difference. The patient who chooses the cheaper option needs a second surgery, probably in their 60s, a second recovery, a second time under anesthesia, and a second time tissue is being lifted off tissue that has already been operated on, which, by the way, makes the second surgery harder, not easier. The cheaper option isn't cheaper, it's just deferred. So if longevity matters to you, that math is the entire conversation. Truth 4. Combined procedures change the comparison. Most patients who need a facelift don't need just a facelift. They need work on the neck, sometimes work on the eyes, volume restoration, maybe a chemical peel, maybe even a brow lift. The face ages as a whole, not just one region. When these procedures are bundled into one anesthesia event, one operating room session, they cost dramatically less than doing them separately. One anesthesia bill, one facility bill, one recovery period. So when patients comparison shop facelift prices online, they're often comparing the wrong numbers. The right comparison isn't just a $15,000 facelift versus a $35,000 facelift. It's a $15,000 facelift plus separate everything else versus a $35,000 combined approach. Furthermore, all of our quotes also include things like hyperbaric oxygen, high-intensity LED, and post-operative IV therapy, all designed to speed up the healing process. Apples to apples, the combined procedure is often the better deal, even at the higher number. Truth 5. What's not in the quote? This is the one that matters most. The most important things about your surgery aren't even in the quote. How many times has a surgeon performed this exact procedure? Not just facelifts, but a deep plane facelift with a deep neck lift, with submandibular gland debulking. This exact procedure, including volume, including brow lifts. Is the anesthesia provider a board-certified anesthesiologist or a nurse anesthetist being supervised remotely? Is the surgical facility an accredited facility with all emergency equipment or just an office-based facility with no third-party oversight? What's the surgeon's revision rate? What is his complication rate? Did he take a weekend course? Is he fellowship trained? Is he board certified? All of this matters. Surgeon volume, surgeon expertise, board certification, and all of this adds to the cost of the procedure. It gives you peace of mind that you are getting a procedure that you will likely not need a revision procedure and a secondary anesthetic. None of this shows up on a price comparison, but all of it shows up in your result. Sometimes during the surgery, sometimes in the hospital or the recovery period afterwards, sometimes 5 years later when the lift just doesn't hold up and you find out that the surgeon didn't actually do what they say they did. The price comparison is the easy part. The credentialing comparison is actually what predicts your result. So, let me be direct. In my Houston practice, a deep plane facelift starts at $35,000 and goes up to about $45,000, depending on what we are combining. These prices are all inclusive, including the surgery, anesthesia, a board-certified anesthesiologist if we're doing IV sedation or general anesthesia, post-operative care, hyperbaric oxygen, IV therapy in your post-operative period, high-intensity LED in your post-operative period, all of it. All of this is included. No surprises at billing. I'm not telling you all of this just to defend the price. I'm telling you so you can compare like for like with anyone else you're considering. Here's something most surgeons in my position won't tell you. The $15,000 SMAS lift is sometimes the actual right answer for some patients. If you're 45 years old, You want to look refreshed for a wedding that's 8 months down the road. You have a very finite budget, and you're going to be honest with yourself and say, hey, I don't think the longevity really matters to me, and I'm okay with getting another procedure down the road in my 60s. Well, in that case, the cheaper option might genuinely be the right decision for you. Not every single person needs a 15-year result. Not everyone is choosing between cheap and good. Sometimes they're choosing between cheap and temporary and expensive and permanent. Either answer is completely defensible, depending on what you actually want. I'm not here to push every single patient into my operating room. I'm here to make sure you understand what it is you're actually choosing and what you're actually paying for. If you want a real quote that includes everything, no surprises at billing, or you just want to talk through whether or not a deep plane facelift is actually right for your objectives and your anatomy, I'd be happy to walk you through in a consultation. The link is just below this video. I truly appreciate your time. Thank you so much for watching.